In this week's breakdown, I'm going to be covering upper cervical dysfunction, specifically in the suboccipital muscles of rectus capitis posterior major and rectus capitis posterior minor. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method, where we teach self-employed massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% and easily double their income. Upper cervical dysfunction, I'm talking specifically from like the occiput to probably like C1, C2, and C3, can present with a whole vast array of problems, but a lot of those issues, I believe, and I have seen in my own practice over the last 10 years, are a musculoskeletal component, specifically in the deep suboccipital triangle, specifically on the rectus capitis posterior minor and rectus capitis posterior major. I got my fancy spine with models out there, and this one, I really like this model because it does show a good, realistic depiction of those suboccipital muscles. Both of them are in here. The one out here, more lateral, kind of goes at that 45-degree angle. That's going to be rectus capitis posterior major, and then really deep in here, that's going to be rectus capitis posterior minor. They're very deep. They're actually really hard to get to, and a lot of practitioners think that they're actually treating those muscles when they're actually really just treating like the upper trap, a little bit of like semispinalis cervicis and capitis. They're not actually getting on there. So an issue that I end up seeing is there's a lot of blood vessel flow and also some nerve entrapments up there, specifically like in the occipital nerve. So a lot of people that are presenting with like tension headaches, migraines, all sorts of problems actually have some of this cervical dysfunction, specifically higher up in that C0, 1, 2, 3 region, and people aren't actually able to get to it and fix it accordingly. A couple presentations when there is upper cervical dysfunction. One is just those chronic headaches. A lot of people might end up presenting with like a migraine, tension overall. Another thing is just overall altered biomechanics. So when that upper occiput can't move how it's supposed to and slide and glide on itself, what happens is it kind of juts your head forward here to make up for that, which in turn puts more pressure on the lower part of the cervical spine, specifically like in the C5, 6, and 7 range in there. And that's where a lot of people end up having like disc bulges, disc herniations, because there's altered biomechanics higher up, and basically just a lot of unresolved neck pain. A lot of people, when we work on their necks and we look at the symptom of the neck problem, we tend to focus lower down. But a lot of times, if this ain't moving right up here, it's going to cause some issues down there. Now, the chiropractors, they'll talk about the whole idea of like the atlas and the axis like going out of place, and they fix it. Bone goes here, they put it back in place, and you need an upper cervical adjustment. What I look at it as is it's a soft tissue component. The bone is like the brick that goes out of place. The soft tissue is like the mortar. So if you fix the mortar, it holds in place. So the chiropractic adjustments help temporarily, but they're not actually fixing things, and they have to continue to put them back into place. Why not fix the soft tissue so you don't have to keep going back to the chiropractor? But that's a whole different business model and a whole different rant that I could go on. So why is this area so dysfunctional? I would just say life and postures. You're probably watching this looking down at a device. We spend too much time sitting, not moving around. And when we do that, the muscles get overworked. They don't get enough blood flow. They don't get enough oxygen, and they actually develop scar tissue. Weird, you can get scar tissue without an actual injury there. What happens over time is the muscles are constantly contracted, don't get enough blood flow and oxygen, send a signal to the brain that there's hypoxia, lack of oxygen there. Body starts laying down scar tissue. Before you know it, it builds up. Muscles weaker, less flexible. Now it doesn't move, which in turn puts more wear and tear on the joint, the cartilage, the ligaments, the surrounding fascia, and puts more pressure on there, causing bigger problems. Like I said, this area is so important to overall just good functioning biomechanics in the cervical spine. The problem is a lot of people aren't actually getting deep enough and effective on it. If they try to go deep, they're actually too deep and they just piss it off and beat the hell out of the tissue. It's got to get just right. You want to get just the right amount of depth and the right amount of tension to break that down. So what I want to include in this week's breakdown is a treatment example using my system called the Peak Method and a treatment called manual scar tissue treatment. I'm going to link that in so you can see how precise and focused I am at getting proper depth and tension on that area of restriction and fixing it for good. So check out that video. So once we decompress the disc, we do the work in the nuchal, the levator, and even the nerve roots, sometimes there can just be some local tension in the upper cervical region. A lot of times when we're doing that test, it'll just be limited and the client will point in there as well. And what can happen, at the base of the occiput from C1 down to C2 is there's some nerves called the greater occipital nerves. They can get stuck to the deep suboccipital muscles. They can get caught through the upper trap. They can get caught in a lot of different areas. And if you can get in there and get some of that tension, it's going to allow this to help to glide a little bit better. So the setup for this is essentially what you're going to do is you're going to have the client lay down, and you can have them right up against the table. That's going to let things relax. You're going to take this first hand and you're going to get some of that extension on that occiput. That's going to create that knife edge. And then essentially you're going to go down to about C3, and that's going to get that to open up. And when you do that, you're basically going to sink in there with your depth and then pull tension right up to the occiput. And your hand here will be where you will stop. So it's just above the occiput on there, and that's where you're going to pull in there as well. Stay very central and very localized in here. You don't want to go too far lateral because you're going to actually fall off of it. But when these nerves get jammed up, it can cause some big problems. So as we showed on the spine, you're going to take this opposite hand, and it's just going to have the occiput right in there, and that's going to open that up. You're going to go down and find about C2, C3, and where you're going to go in there is you're going to sink, just like that, and then that's going to get your depth as you open up, and then you're going to pull tension straight up. And with this one, you're not going to stand up, you're just going to pull that, and you're going to lean back and pull that through as you go right up to the base of the occiput. Your hand gives you an idea where you're at. And with this one, you want to get that extension. That opens that up. You're going to back off. You're going to pull that tension and come up nice and easy. You can see I'm using this opposite leg to kind of help with some of that motion as well. And when this area is dysfunctional, it can cause a lot of problems in there. But you don't want to go too far. You go to maybe about C3 is the furthest you want to go. Get some of that extension to open it up. And then you're going to pull that tension straight up. That's going to help that open up. Take homes here that people completely miss. One is consider nerve entrapments causing a problem. So nerves need to make their way through the body to get to a lot of places, and there's over 256 different places in the body where a nerve entrapment can occur. And a lot of times those presentations come into you as like numbness, aching, burning, and tension, and those nerves get stuck with all that scar tissue in there. And what happens is we end up beating up the tissue too much, and we're not getting the right amount of depth and tension to break those nerve entrapments down, which, if you don't fix them, they're going to continue to come back. Understand when you have a headache patient, there's a lot of factors in there. I made a more in-depth video about headache presentations and what they look like. I'll link it up on the YouTube channel right here. Some questions to understand if this is truly a musculoskeletal problem or if it's something more psychosocial, hydration issue. Maybe they're just batshit crazy, you never know, but it'll help you really understand if it's going to be a slam dunk and if your soft tissue treatment is going to be able to help that headache instead of just having to chase the never-ending rabbit that never gets better. Next take home, slow down. Once again, slow down. We tend to be so quick to want to jump into treatment, like just get on the table and I'm going to feel in there. I can sense the way you're moving and I know exactly, like I'm an intuitive healer. Like get the fuck out of here with that. Slow down, ask the right questions, do functional evaluations, do the right palpation, find the area that is not working correctly. Don't just assume that because they have a neck problem that it's somewhere down low. Look at tests, look at movement, get in there, slow down. I always say if you want to go fast, you got to start by going slow. Funny. And lastly, focus on fixing one problem at a time. People will come in with a neck issue and then you're like, well, I got to do a whole body thing because if the ankle's not moving right, it's going to fuck the whole chain up. Like, yeah, I get that, but you got to start like very regional and figure out what the problem is first and then work your way out. Like this whole idea of like, I got to treat the whole body in one treatment and I need to do a 2-hour marathon session. You're not getting anything done, nothing productive because you're not focused on that thing. Focus on one part per visit and then stack it up and get a little bit better each time. Quit trying to do everything in one visit. Get them better, 5 to 7% better per visit, and that focuses on working regional, and then going more global. So that's all I got for the video. If you like the video, give it a comment, a like, or share. If you got any specific topics you want me to cover, send me a message. Always here to help. Go grab my free training. I put a lot of information out there that I think is better than any paid course, because I just want you to be a better version of yourself and get this care to more people so people don't end up being on pain pills, all fucked up, all sorts of problems. I've been swearing a lot in this video, but that's okay. It's my inner spirit. I like to swear. Once you get the free training, go through it. And if you like what you see, come take one of our CEU approved courses. Come learn with me and become a ninja, a master, a soft tissue specialist, and get the life and the business and practice that you deserve. I appreciate you guys watching, and I'll see you on the next one. Bye.